Hi, this is Michelle Corson, Public Relations Officer with Kern County Public Health. We are getting a lot of questions from our community about the novel coronavirus. So on a regular basis, we want to keep you up to date. We're going to be performing updates regularly for you to keep you and your families prepared and informed. I'd like to get started with the fact that the Centers for Disease Control, as of March 3rd, reported 108 cases of COVID-19 in the United States, including 6 deaths. Here in Kern County, we are doing what's called our monitoring program. And what this means is, if you're a traveler that has traveled internationally and you have made it through one of the 11 designated airports here in the US, and you are not symptomatic and you are considered low risk, although you have traveled somewhere where the COVID-19 is circulating, you are allowed to come home. But your names are provided to local health jurisdictions, so we can just follow up with an abundance of caution to ensure that you don't develop symptoms. So our staff will assess you, and if you are needing to be monitored during that 14-day period, we are doing that. We have received 14 names of travelers as of today, and only 3 remain in our monitoring program. The rest have successfully left the monitoring program and are deemed well and not a risk to the community. In addition to the monitoring program, we also receive referrals from our healthcare professionals for persons under investigation. So through the Centers for Disease Control, if you demonstrate certain symptoms and you have a travel history, or there is a series of criteria you would meet, you then must report that to the Kern County Public Health. In addition to our monitoring program, we are also testing local residents. Currently, there are 4 residents that have met the criteria for testing, and we have submitted their samples to the state where they are undergoing the testing, and we will keep you apprised of those results. There is no confirmation of the circulation of COVID-19 here in Kern County, and we do encourage, though, our community to take the common steps to be prepared every day. Wash your hands, stay home if you're sick, and continue to visit our website for ongoing updates. And finally, the tip of the day. A common question is, when is it necessary to seek medical care? And it is flu season, it's cold and flu season. So only you can be the judge of how ill or well you feel. But if you start experiencing symptoms such as, difficulty breathing, you should seek medical care right away. But if you are concerned at all that your symptoms are persisting and you have a high fever, we would encourage you to call your doctor and discuss this with them. Some have, nurse advice lines. There's a lot of different tools depending on the medical care you receive. But we encourage you to know your options before you go to the emergency room or utilize an urgent care setting. We would encourage you to contact your doctor by phone first. So that really concludes today's update. Again, we will be providing regular updates here at kernpublichealth.com, and thank you so much. Take care.